my name is Roger Medina, and today I'll be talking about health disparities and inequities. Health disparities are basically, you know, someone's health. For example, health disparity refers to differences in the health status of different groups of people. This includes race, gender, sexual orientation, geography, income, where you are, where you live, how you grew up, and all that sort. Health disparities are an important public concern as they are related to the social inequalities of population health. According to Healthy People 2020, health disparities are linked to a group's background and their determinants of health. Determinants of health are basically the factors that you were born with, such as biological factors, your relationships that you have, the orientations that you do, and basically your daily life that you cannot control or change otherwise. Health disparity is an issue. So this is becoming an issue because it is does not only affect the groups, but it also affects the overall population. Disparities in health and healthcare, like I said, not only affects the groups facing disparities, but it also limits overall gains in quality of care and health for the broader population, which results in unnecessary costs. Basically means that if we don't focus on the disparities of these groups and that they can't control, it's going to be more costly since we have to figure out we have to use more resources to help them rather than already developing these resources to already have ready for them. Addressing health disparities is increasingly important as the population becomes more diverse. Healthy People 2020 aim to eliminate health disparities. Health disparities affects minorities more than other populations. What this means that it affects those that do not have equal access to, let's say, non-minorities. These minorities can include Asians, Africans, mostly people that aren't, white or born here in America. According to the American Medical Association, recent studies have shown that despite the improvements in the overall health of the country, racial and ethnic minorities experience a lower quality of health care. They are less likely to receive routine medical care and face higher rates of morbidity and mortality than non-minorities. This is because they aren't exposed and they don't have access to the health. They don't have access to the health per se, medications and equipment and resources that those that non-minorities have access to and are privileged to have. It's just that they don't realize that they are privileged to have it, and also those minorities, they refuse to get help just because they don't have the income or because it's too far to get it, it's not local, and they don't have a source or that resource available to them. Initiatives to end health disparities. So we can all help to eliminate health disparities by, making the problem bigger than it is and realizing that there is a problem and using the health belief model. According to Surgeon General, some ways to end health disparities are ensure a strategic focus on communities at greatest risk, so basically focus on the minorities and make it more aware. Reduce disparities in access to quality health care, so we have to make healthcare more affordable and more available to others. Increase the capacity of the prevention workforce to identify and address disparities. So this is going to be able to educate doctors and make sure that they understand how to assess these health disparities. Support research to identify effective strategies to eliminate health disparities and standardize and collect data to better identify and address disparities. Healthy People 2020 are already collecting data with diseases. Health inequities are avoidable inequities in health between groups of people, within countries, and between countries. These inequities arise from inequalities within and between societies. These are similar to health disparities that it focuses on the groups. Healthy People 2020 are aiming to achieve the health equity of these. Health equity is the attainment of the highest level of health for all people, which means that everybody is healthy and there are no health disparities for anyone. Solving health inequities is throughout the next decade. Healthy People 2020 will assess these health disparities in the U.S. population by tracking the rates of illness, death, chronic conditions, behaviors, and other types of outcomes in relation to demographic factors. These demographic factors could excuse race and ethnicity, gender, sexual identity and orientation, disability status or special healthcare needs, and geographic location. And this also affects their income, and this will help eliminate the health disparities overall. All right, thank you guys for listening.